You are probably looking at your breakfast plate, tracking the math, measuring the exact ratio of carbohydrates, proteins, and fats to control your energy. But by focusing entirely on the chemical makeup of the plate, we ignore the physical mechanics of eating it. The exact time of day you eat and the precise number of times your jaw breaks that food down dictate how your body processes that energy. Clinical research from Hokkaido University proves that chewing the exact same food differently at 8 a.m. versus 8 p.m. drastically alters your blood sugar. And once you see the data, you will want to change your breakfast routine tomorrow. This chart shows a postprandial glucose spike, the rapid surge in blood sugar immediately following a meal. To safely clear that sugar out of the danger zone, your pancreas has to release a quick, early phase burst of insulin. If that early response fails, the spike stays high, setting the stage for metabolic dysfunction. Flattening these dangerous blood sugar spikes relies heavily on an overlooked mechanical action you perform thousands of times a day: chewing. Researchers brought in a group of healthy young men and fed them identical portions of white rice. Half the subjects were instructed to chew 10 times per mouthful. The other half had to chew 40 times. When they ran this test at 8 o'clock at night, the extra effort did absolutely nothing. The 40-chew group recorded the exact same blood glucose levels as the 10-chew group. But this split-screen chart compares the evening and morning results. While the 8 p.m. lines overlap perfectly, the 8 a.m. data diverges drastically. By the 60 and 90-minute marks, blood sugar levels for the morning 42 group plummeted compared to the quick eaters. That massive drop is driven by insulin. In the morning, chewing 40 times forced a sharp surge in early-phase insulin secretion, physically pulling that glucose down. At night, that identical chewing action failed to provoke any extra insulin. Chewing your dinner 40 times is a functionally useless metabolic intervention, but executing that exact same physical rhythm in the morning triggers rigorous glucose control. To understand why the clock dictates the outcome, we have to look inside the brain at the suprachiasmatic nucleus. This tiny region operates as your master biological clock, regulating your circadian rhythms. That master clock naturally primes your body for action early in the day. It establishes a significantly higher baseline for glucose tolerance and insulin sensitivity in the morning compared to the evening, waking up your digestive system and pancreas. Morning mastication does not create this high glucose tolerance. It acts as a biological enhancer that exploits this highly active morning phase. The moment you start chewing, you stimulate the vagus nerve. This bypasses the normal digestive timeline, triggering a preabsorptive or cephalic insulin response. Your pancreas starts secreting insulin before the food ever reaches your stomach. Thorough chewing also increases diet-induced thermogenesis. The extra physical effort required to break down the food generates internal heat, and that heat strongly correlates with higher postprandial insulin release. Breaking a mouthful of food down 40 times is a direct neurological alarm bell. It warns the pancreas to prepare for incoming glucose exactly when your biological clock is best equipped to clear it. Aligning your meal timing and eating mechanics directly with your biological clock is a practice known as chrononutrition, and it offers a massive metabolic advantage. It also provides an immediate payoff for obesity management. The brain's satiety center requires approximately 15 minutes to officially register fullness. Slowing down your bite mechanically forces your meal to outlast that delay, acting as a natural guard against overconsumption. Prolonged chewing drives up saliva production, which neutralizes acids to prevent cavities, while the intense mechanical breakdown maximizes your ability to absorb nutrients. Eating slowly and deliberately reduces the daily workload on your pancreas, turning a basic mechanical habit into a holistic tool for disease prevention. Thorough morning chewing syncs perfectly with your circadian rhythms to boost early-phase insulin and flatten out dangerous glucose spikes. So here is the exact target for your next breakfast. Aim for 30 chews per mouthful and make sure your meal lasts at least 15 minutes. If 30 chews feels like an impossible marathon, start smaller. Tomorrow morning, simply add 5 extra chews to whatever your normal bite feels like and gradually scale up. To stretch the clock past that 15-minute mark, put your utensils down between mouthfuls and leave your smartphone in another room. You can also hack the meal itself. Incorporate high-fiber ingredients like mushrooms and sweet potatoes, or simply cut your food into thicker, chunky blocks to physically force your jaw to work harder. By changing the physical tempo of your breakfast, you actively collaborate with your biological clock to secure a healthier metabolism for the rest of the day.